Not lasting long enough in bed, it sucks. And you might have heard someone say that Kegel exercises can help, but they actually might be hurting you. Today, I'm bringing my friend and pelvic floor physical therapist, Leckie, back to the channel to help us learn which exercises actually help you last longer in bed. First, let's talk about what premature ejaculation actually is. It's essentially ejaculation happening within 1 to 2 minutes of penetration, and it's causing you or your partner distress. To me, honestly, it doesn't really matter how long you last, but that you and your partner are having a mutually pleasurable and enjoyable sexual experience. If not being able to last a certain amount of time is affecting your relationship, your self-confidence, or your mental health, it's a problem. And the reality is you're not alone. This issue affects almost 3 out of 10 men. That's 30%. Now, we currently don't have any on-label medications designed to treat premature ejaculation, but there are some behavioral techniques that can help. These can include things like the stop-start technique, where you're essentially pausing when you get to the point where you're about to climax, you're close to climax, and you wait for your arousal to drop down and then resume. Do that 3 times, and on the 4th time, allow yourself to climax. The other option is the squeeze technique, where your partner applies pressure just below the head of the penis during those pauses where you're right about to climax to reduce arousal. Now, the issue with these is a lot of them require your partner to be on board, and it can sometimes be really frustrating in practice when it doesn't work well. And if you've been on my channel before, you already know that I've talked about some other ways to improve your ability to last longer, like diaphragmatic breathing, which activates your parasympathetic nervous system, or your rest and digest mode, which essentially naturally reduces your arousal intensity, and even things like high intensity interval training, yoga, and running that have actually been shown scientifically to help people last longer in bed by reducing stress and improving your ability to regulate your nervous system and interoception, like knowing where your body is in space. Now, lasting longer is one piece of the puzzle, but what about overall sexual pleasure for you and your partner? I've put together a free guide with my top 10 evidence-based tips for sexual pleasure. Check it out today for free at www.renamalikmd.com/morepleasure. But today we're focusing on something many people get wrong: pelvic floor exercises for premature ejaculation. And to help explain this, joining us today is Doctor of Physical Therapy, Leckie.
Hey everyone, my name is Leckie. I'm a men's health physical therapist, I'm a fellow YouTuber, but more importantly, I too have struggled with premature ejaculation. It's absolutely miserable, it's downright embarrassing, and if you're watching this video, you are looking for solutions that actually work. And that's what Dr. Malik and I are aiming to give you. Now, I want to make something really clear. Before I went and specialized in the male pelvic floor, when I was dealing with my premature ejaculation, I was making one massive mistake. I had the belief that if I were to just do more and more Kegel exercises, those are exercises that are strengthening your pelvic floor muscles deep down inside your pelvis. If I would do more of these exercises, I believed that that would actually help my problem. In fact, it made things a lot worse. If you are anything like me and you're doing lots of Kegel exercises every day in hopes of lasting longer in the bedroom, we need to stop that right now. What I think is happening, it's called pelvic floor hypertonicity. It's a very fancy way of saying that your pelvic floor muscles are likely very tight. It's true, you can overdo Kegel exercises, and I'm finding it is a cause and one of the culprits behind premature ejaculation. So if you are doing boatloads of Kegels, I want you to press pause and I want you to do this routine instead. We are going to focus on pelvic floor relaxation, calming down these muscles so that they don't tense up as much when you're in the heat of the moment. It's going to allow more blood flow down to your penile tissue, and it's going to help you on your road to recovery to lasting longer in the bedroom. Because reflect on this really quick. When you're in the heat of the moment and you are practicing intimacy with a loved one or whoever, you are very stressed. You are trying for the life of you to hold on. You are trying not to ejaculate too soon and to let yourself and your partner down. That's a very stressful environment. What's happening is your blood cortisol level, your stress hormone, is rising and it's getting higher and higher. What's happening when your blood cortisol levels rise is it snaps shut your pelvic floor. And if those muscles are already too tight, it's like a brick down there. There is no movement at all. That is making your premature ejaculation far, far worse. So this is what we're gonna do instead. Why don't you join me in the living room, and I'm gonna take you through my 3 top exercises to relax these muscles and to release them so that it can calm down your central nervous system, leave you in that rest and digest phase so that you can have a good erection that actually lasts longer than 30 seconds. Let's get into the stretches, shall we? Come on. All right, everyone, you can join me down on the floor. You can either lay out a yoga mat, or if you don't want to get down on the floor, you can do these in the bed as well. I'm taking you through 3 of my top pelvic floor stretching exercises that is going to help you melt away all the tension built up within your inner thighs, your quads, and most importantly, your pelvic floor. We are reducing that tension. Now, there are 2 rules. Number 1 is you are holding each stretch for 60 seconds. So you can either use a watch, a phone, or a stopwatch. 60 seconds for each of the 3 exercises. Rule number 2 is I don't want you holding your breath. This is not a breath holding challenge, so please focus on breathing fluidly throughout and resist the urge to hold your breath. Let's get into it. Stretch number 1 is called stirring the pots, and its only goal is to start loosening up these hips, because the third and final stretch I think you're gonna find the most challenging, but it's where all the results are gonna come from. All right, grab a pillow on the floor so that you're nice and comfy. I'm gonna be on an angle here so you can see me. Stir the pots looks like this. Bring your knees up to your chest, clasp around your knees, and you're gonna pull those knees wide around and up. Bring them down, wide around and up. Your goal is you're really trying to pry those knees wide as you swing them around. Take this slow. You shouldn't feel any pain. We're just trying to loosen up those hips, okay? You should feel this deep within that groin, the internal hip capsule. And we're doing this for 60 seconds, just slowly warming up the hips as you breathe in through the nose and out through the mouth. That is hip stir the pots. Stretch number 2 is in the same position, so you don't even have to move. You're welcome. This is called knees to chest stretch. So how you do the knees to chest is lying flat on your back. Again, clasp around the knees. This time, bring those knees as tight as you can into your chest, and then pry the knees directly out to the side until you can start feeling a very focused stretch in your inner thigh, the groin, and your pelvic floor. And again, you're gonna hold this for 60 seconds. Big breath in and breathe out. Because remember, the natural reaction for your body is to tense up and to hold this. But remember, tensing up and holding that pelvic floor contraction is one of the reasons that got you into this situation to begin with. So resist that urge, breathe in through the nose, out through the mouth. As you hold for 60 seconds, you're gonna notice that your hips are gonna start loosening up. So use those biceps and pull the knees even wider and breathe and relax into it. Once that 60-second timer goes off, that is knees to chest stretch, done and dusted. Now the third and final stretch, the home run, the stretch that I think is going to be the most difficult but also give you the most bang for your buck is the happy baby. It is my favorite pelvic floor stretch ever. This is what the happy baby looks like. Again, in that same position, you don't need to move an inch. You're going to bring your feet up towards the ceiling, take your arms, reach through the knees, on the inside of the knees, grab onto the outside of the feet. You can see why the first 2 stretches were just focused at warming up the hips, because you probably wouldn't have a good time getting into this position. Now, once you grab on the outside of the feet, use your elbows and spread those knees shoulder width apart. You're gonna hold this position and breathe. Sigh out. Relax into this position, and I can already feel this so deep into my perineum and my pelvic floor, it is ridiculous. So close your eyes, breathe into it. Now, as that pelvic floor starts to loosen up and that stretch gets a little bit easier, well, guess what? Now you can pull those feet further into the ground. Bring those knees closer to the ground, and oh my word, is that a good stretch? I can barely talk through this. This is the happy baby. As you can see, you want a perfect 90-degree angle between your shin and your thigh. Feet are directly perpendicular with the ceiling, holding for, you guessed it, 60 seconds.
I personally love happy baby pose. It's one of the ones I tell all my patients to do to help keep the pelvic floor relaxed and functioning normally. Even I do it all the time.
All right, guys, those are my top 3 pelvic floor stretches that are gonna help you just melt away all of the built up tone and tightness within your inner thighs and your pelvic floor muscles. They are the exact opposite of Kegel exercises. Now, what worked really well for me was doing this routine twice a day. I would do it first thing in the morning to kind of set myself up, and then I would do it at night after dinner. Twice a day, holding each for 60 seconds. That's all it took for me to start down regulating and stretching my pelvic floor. I don't want to give off the wrong idea. We are not demonizing Kegels. Kegels certainly play their role, especially in increasing the strength and rigidity of your erections and helping you empty your bladder. But when you are dealing with premature ejaculation, they are not helpful. I hope you found this beneficial. Dr. Malik, thank you so much for inviting me back. This is now collaboration number 2. It is an absolute pleasure to speak to your audience and to share strategies on a problem that I know all too well. Now, over on my YouTube channel, you will find pelvic floor stretching routines, a heap of workout videos, and a lot of videos surrounding this topic and helping you to overcome premature ejaculation. I'm wishing you all nothing but the best. Thank you again, Dr. Malik, and I'll see you in the next video.
Thank you so much, Eric, for joining us today. I want you guys to remember that premature ejaculation is a really challenging issue, and it has a lot of different options to help you last longer. That can include those behavioral techniques I talked about, some of these exercises, as well as other lifestyle changes. So make sure to incorporate all of these different things to be able to really optimize your sexual experience. And check out my videos where I talked about diaphragmatic breathing and exercises to help last longer. We also have delay sprays and off-label medications. And if you want a really great comprehensive review of all the options for premature ejaculation, check out my podcast, the Rena Malik MD podcast, which is here on YouTube as well as on your favorite podcast platform. The episode is titled The Truth About Premature Ejaculation Most Men Don't Know. And if you have questions about physical therapy, Eric's channel has tons of more content on pelvic floor health and men's wellness. So make sure to check out the link in the description below. Did you guys know that YouTube shows my videos to more people when you subscribe? That means that more people who are struggling in silence get actual evidence-based solutions. So if this helped you, subscribe to help the next person. And as always, remember to take care of yourself because you're worth it.